let's talk about a common topic that arises, particularly in the setting of testosterone replacement therapy, which is elevations in hemoglobin and hematocrit, right? And so people oftentimes panic unnecessarily when they see a rise in that number on therapy. So, not to say that there isn't such a thing as excess, but first things first, realize that there is actually quite a benefit from raising that number to a point, right, on testosterone therapy. Why? Because higher hemoglobin and higher hematocrit, again, to a certain threshold, translates to better blood flow, better oxygen carrying capacity to all vital tissues, right? So better blood flow to the penis, you can do the math on that, better blood flow and oxygenation to the brain. Therefore, there's a cognitive enhancing effect of testosterone therapy. It happens to be in large part related to this rise in hemoglobin and hematocrit, right? As it often is the case with things in life, clearly there is such a thing as too much. And so for that reason, we always recommend frequent blood work so that you can see a pattern and you can detect whether there is something that needs to be done with that or not. I would even offer, aside from this issue, there is a benefit, particularly in men, in donating blood frequently, right? And this is even aside from the testosterone issue, right? So men obviously don't have menstrual cycles for years and years and years, and so you're left with at least the possibility that you can accumulate iron into tissues. And if you've ever seen anything rust, you basically realize that iron is subject to oxidation, right? So if you can keep that number relatively low, not low, pathologically low, but in range by donating blood regularly, you're actually doing yourself a service, and obviously, above all, you're helping somebody else who needs blood, right? So, and this is again, completely aside from the issue of testosterone therapy. The idea with testosterone therapy is that not everyone responds the same way. So if you do it correctly and you stay within physiologic parameters, the likelihood that you have to donate blood specifically as a reason of TRT is actually surprisingly very low. Clearly, if you abuse dosages and you do things on your own and you're taking large amounts that are way above physiologic range, you're going to have a lot more likelihood of that happening. But realize that there is absolutely a health benefit in donating blood regularly, whether or not you're on testosterone therapy. Also remember, as I first said in this segment, that there is benefit in raising that number to a point, to a critical threshold, right? And that threshold, despite the fact that labs have reference ranges, that threshold does matter a little bit person to person. So it depends on age, it depends on functional status, it depends on what kind of activities the person engages in, and so on and so forth. But so there is a benefit. You just have to find the narrow range of what is ideal for you to be optimized so that you have the ideal amount of blood flow, of oxygen floating through your body so that everything works 100% as it should. Any questions on that, feel free to reach out to us.